It aims at improving their health status and reducing risk behavior that contribute to poor maternal and child health outcomes. The ultimate aim is to improve maternal and child health in both the short and long term. The reason why we are more focusing on the preconceptional care is normally the pregnant women come to the hospital for first visit after conception. By the time half of the embryo might be developed, whatever risk she was having before conception may adversely affect the fetus as well as the health of the mother. For example, if we say the undernutrition and iron deficiency anemia increase the risk of maternal death, accounting for at least 20% of the maternal mortality worldwide. The same way, women with epilepsy are at increased risk of having congenital anomalies. This is because of both conversion, what they experience, and anti-epileptic drugs given. So, if she is coming for preconceptional visit, this risk can be reduced, lifestyle modification and treatment can be given to rectify the condition. So, now I'd like to introduce the speaker for this session, Miss Asha Abraham. She is a registered nurse with California Board of Madam has completed her Bachelor of Science in Nursing from Rajkumari Ambedkar College of Nursing, Delhi University, done her Masters in Obstetrics Gynecological Nursing from Rufaida College of Nursing, Jamia Hamdard University, New Delhi in 2011, done her another Masters in Executive Nurse Leadership from Hahn School of Nursing, University of San Diego, Canada in 2015. Madam has started her career as a recovery room nurse at Exact Heart Institute and Research Center, New Delhi from August 2008. Then, Madam has worked as a nursing consultant in National Institute of Health and Family Welfare, New Delhi, India. After her Masters, Madam has worked as nursing tutor at Holy Family College of Nursing, New Delhi. Then worked as a clinical nurse at executive nurse leader at Sharp Mary Beach Hospital for Women and Newborns, San Diego, Canada. At present, Madam is having the position of advanced clinician at the same hospital. Apart from that, Madam is a member of many professional associations and she has many publications in her credit and has completed many certification courses like Basic Life Support by American Heart Association, Advanced Cardiac Life Support, Neonatal Resuscitation Program, etc. And also, Madam is a certified lactation consultant. Welcome you, ma'am.
Thank you so much. Can you guys hear me okay? Are you guys able to hear me?
Yes, ma'am, yes. We can hear you.
Thank you. I think earlier I was trying to share my screen, but Debajani is going to share her screen and my PowerPoint. Well, thank you so much, Gumti Madam, for such an elaborate welcome. I'm glad that you guys have given me an opportunity to present on two of very important topics. So as Gumti Madam has already kind of gave you a preview of what is preconception care, and I will also later on focus on Planned Parenthood. They kind of like go hand in hand. Preconception care starts from the early childhood to a late adolescent age, as well as the Planned Parenthood involves, it's kind of like an ongoing care. So first of all, we're going to focus on the preconception care. Next slide, please. So preconception care, as Gomti Madam has already said, it's kind of like I said, it starts from early childhood to late adolescent period, and as WHO has rightly described, it's a provision. Maternal undernutrition and iron deficiency anemia is also another major risk factor that can be addressed in the preconception care. Perinatal deaths are 50% higher. 50% higher among children born to mothers compared to age 20 to 29 years of age. So basically, when they are younger, their access to health care is kind of like limited as compared when they are well advanced in age. So the rate of perinatal deaths are also higher. Untreated gonococcal infections. So these can be addressed in the conceptional care. They can be treated, and thus the maternal or the infant mortality can be reduced. HIV transmission, again, the focus on the vertical transmission from mother to child can be addressed in the preconceptional care, and that can be reduced as well. Violence against girls and women. So there are, again, environmental factors that can be addressed in the preconceptional care and thus taken care of early on. Women with epilepsy, again, are at increased risk for having babies with congenital anomalies. So some of these, they can be addressed in the preconceptional care, and thus you can always focus on what issues or what risk factors the woman or the man might have and address them early on. Next, please. So investing, this is kind of like this will why the investment in the preconceptional care in Sri Lanka. They have implemented the preconception program and are doing very well. Next, please. So when we say preconceptional care, we have like kind of touched on what all it encompasses, but mainly it focuses on the nutritional conditions. So like I already talked about, the maternal nutrition is one of the important aspects of the preconceptional care. The iron deficiency anemia, which can be corrected when they are screened early on. Diabetes, because it's not, people are more into like sedentary lifestyle. So all these lifestyle disorders can be screened prior to a woman getting pregnant. They can be given iron and folic acid supplementation, thus correcting the iron deficiency anemia. They can be their nutritional status can be monitored, and in case they are diabetic, they can be we can help them manage the diabetes before they get pregnant. Also, the iodization of the salt, that's another thing that can be corrected in the preconceptional care. Second is the tobacco use. So as we know, like tobacco use can result in stunted growth, preterm labor. So all these things, some people, the women, they even though they do it, they might not think about the consequences that might have on pregnancy or on the fetus. So you can counsel them, you can tell them the consequences. You can enroll them in the tobacco, give them tobacco cessation advice, pharmacotherapy to help them with the cessation of tobacco. You can help them with the nicotine replacement therapy. You can also, even though they might not be all smokers, but you can also counsel them on the effect of secondhand smoke in case they are non-smokers. So the harmful effects of all those can result in a poor pregnancy outcome. Genetic condition, another important aspect when we take, like the importance of history is known to all. When we do our nursing program, that's the first thing that we learn. So taking a family history, knowing about their genetic factors is another important thing that is considered in preconception care. So they are given genetic counseling, carrier screening and testing, appropriate treatment of any genetic conditions that they might already be having. So those things are taken care of in the preconception care. Environmental health, basically, they might be in an environment where they have like radiation exposure. They might be exposed to pesticides, lead exposure, or even if no environmental factors, they might consume something that might have an environmental effect on the pregnancy, like mercury in certain type of fish. So all these things can be, we can advise on, we can counsel them on, so that they can have a healthy pregnancy. Fertility, infertility, another aspect of it. People, they might not even think about it, but that's also another area that needs to be considered. In there, we can give them multiple options. We can counsel them. It's important that both male and female partner, they participate in that and find what other alternatives they can have in case they are not able to get pregnant. And in case there is like the preventable causes, they can be treated. But if there's like unpreventable causes, then we can counsel them. So all this is addressed. Interpersonal violence, again, it's important to, again, it comes in the history taking. If you feel like the men or the women, they are in an environment where they are experiencing that interpersonal violence, then they need to be addressed early on. Age appropriate comprehensive sexuality education needs to be given to them. Combining and linking economic empowerment, gender equality, as well as community mobilization activities needs to be encouraged. We need to, like, even when women are not talking, you can recognize signs of violence in the family. So those are things that we need to focus when we are giving preconceptional care. Early unwanted rapid successive pregnancies, another area that is covered under the preconception care. So there are like cultural norms that support early marriage, and so we need to address those cultural. We need to be giving like cultural sensitive care, but we need to let them know the consequences or the disadvantages of having an early unwanted or a rapidly successive pregnancies, what it does to a woman's body, how it affects the pregnancy outcomes. So those all needs to be covered when giving the preconceptional care. We should also engage men and boys to critically assess those norms and practices regarding the gender-based violence, even coerced sex. Educating women and couple about the dangers to the baby when they have the baby in short interval is something that they might not know. So educating them on the disadvantages of that. Next, sexually transmitted infections is again what is covered during in the preconceptional care. So sexually transmitted infections, again, not something that people talk about, not something that people want to seek attention. So they might not be willing to come out and seek medical attention. But when you do the preconceptional care, you can identify those infections, you can give them treatment. You can promote the condom use for dual protection against the sexually transmitted infections. You can ensure they have like access to condoms, access to treatment, and any other relevant services that they need. HIV, again, like I said, they need to know what are safe sex practices, dual method of the birth control, HIV counseling, and testing, where they can seek those. Antiretroviral therapy can be provided so that we can prevent, and also pre-exposure prophylaxis can be made accessible to them. Another area that is covered is mental health. So mental health is, again, like during this COVID time, it has come up a lot, but mental health is something that is like, when you say holistic, when you provide the holistic care, mental health is like a huge aspect in that. So we need to address any psychosocial problems that that the woman or the man may encounter. Provide educational and psychosocial counseling before and during pregnancy in case there is any underlying psychosocial problems. Counseling, treating, and managing depression is also really important. As you know, pregnancy there's like a whole a rush of hormones, and once women once the woman woman has the baby, they have all these hormones that can cause them to have baby blues. They can have all the depressive symptoms. So if she's already struggling with it early on before the pregnancy, then it becomes that much harder for her to focus on the baby or focus on herself. So treating that gives her a head start to handle the pregnancy as well as thereafter. Also, improving access to education for women of childbearing age is another important aspect to improve the mental health of the access to education. Helps to identify, helps her to seek care. Help her to identify any symptoms and seek care too. So, substance abuse, again, it is something that is not very well addressed in other preventive aspects. So again, when screening for people who might be exposed to substance abuse is really important, because they need to know, again, what are the consequences, what are the effects of those substances on the pregnancy and the baby. We can provide them with interventions and treatment during the preconceptional care. Treating those substance abuse disorders early on is really, really important. Providing family planning assistance, again, for families with substance abuse disorders, providing them with resources is important. Also, vaccine preventable disease, again, rubella, tetanus, diphtheria, hepatitis, they all can be treated, and women can be vaccinated before in the preconceptional care. Female genital mutilation, it's seen more in, it's again kind of like a cultural thing seen in certain countries. So they need to be educated on we need to discourage the practice of the genital mutilation. Also, let them know what complication might arise with the mutilation. informing women and the couples about the complications, and providing them access to the treatment. Thank you. Next slide, please. So same thing, recommendation for preconception intervention for men, again, covers the reproductive planning. They should be involved in the planning, planning for the pregnancy. They should be given access to the different kinds of contraceptive options. Their family and genetic history needs to be we need to properly screen them for any kind of risk factors. Social and behavioral history, again, same like the women. We need to know if they are having any history of violence in the family, if they are having any mental health issues in the family that need to be screened and addressed. Sexually transmitted disease, again, even if women takes a step to seek medical care or health care for sexually transmitted infections, men, it's that much more harder for men to address those issues. So those are specific things that can be addressed in the preconception care for men. Again, like I said, physical, sexual, emotional abuse, that's a huge factor in the preconception care. Next, please. So even though we have all these listed out in the preconceptional care, we know what to address, how to address it, but there are like certain barriers that in 1990, a study was done by Jack and Culpepper, and they identified 7 barriers. So I'm going to list it out, but main thing is that most of these barriers are still there in the society today. So like women most in need of preconceptional care are least likely to receive counseling, which we as healthcare workers know. We know who needs the most care and how difficult it is to reach out to them, to get them to come to you to get proper advice. Our fragmented healthcare delivery system is a big factor. Lack of treatment services for high-risk behaviors, like I said, substance abuse, another a big area that needs to be explored, that needs to be screened, and the adequate treatment services provided for them, inadequate physician reimbursement, providing counseling services. So involving those physicians, because for the counseling services, even though sitting there for counseling might not give them a huge reimbursement, but that preventive aspect of care needs to be stressed on, focused on, and that should be highly encouraged. Lack of efficacy of counseling provided to unmotivated patients and their partner. Limited number of conditions with evidence-based preconception interventions. So what are things that are listed in the preconceptional care and how you address it? It's all evidence-based, based upon WHO report. So it's some of the things that we are working on. We are we are trying to come together and build those little action steps to address all the factors that can be addressed in the preconception care. So like limiting the number of limited number of conditions with evidence-based preconception intervention is something that we are working on, and we are trying to get there. So lack of emphasis on risk assessment, health promotion in training programs. So even though we have all those training programs, but how much focus we are providing on the preventive aspect of the care is something that needs to be that we need to think about. So some of these that we are working on, some of these barriers still exist in our society, and something as a healthcare worker we all need to do our part in focusing and giving that preventive aspect of the healthcare, and like we always say, like prevention is better than cure. And we usually don't like to seek healthcare. Like even as a medical professional, most of us don't go and seek that preventive healthcare. So it is a huge aspect. Like as a healthcare worker, we need to be the first ones to be out there seeking those preventive care, preconceptional care, and be the leaders in so that we can encourage other people to provide them access to this care. Next, please. So WHO supports regions and countries in implementing a step-by-step process. So it's not something that I need to work on from ground up. It is something that is already there, and WHO supports the country who is willing to put an effort in building up their preconceptional program. So they create regional, national platforms and partnership, introduce professionals in countries to international experience, research, evidence, and good practices, analyze and understand the strength, weakness of the preconceptional care system in place, and opportunities for improvement. Explore various delivery strategies for preconceptional care intervention, explore and document innovative ways to deliver preconceptional care outside the traditional maternal and child health programs, and develop a roadmap to make changes over time. So it is not something that is it's solid in ground. It is different in different countries. Different countries have their own cultural norms. Different countries have their might have their own healthcare delivery system in place. So it is not something that WHO gives a list of like, this is how you should do. No, they are there to like support you. They are there to provide you with the research, with the good practices, with evidences. So if you are more interested, there's plenty of reports, plenty of roadmaps in WHO website that gives you in detail about the preconceptional care, what are the effects, how in your country you can help build up that healthcare system. So that's kind of like is about the preconceptional care. I try to like, it is like a really huge topic, and I try to pull things from WHO report, and I hope like I am able to shed some light on that. But like I said, please go research some more. This is like kind of like really a small gist of what it encompasses. So please do go and read about it. I have like at the end of the slide, I have some references which you can later on use it for gaining more insight into this. So moving on to my next topic, it's the Planned Parenthood. And like I said, it is kind of like an extension to the preconceptional care. You can have a proper Planned Parenthood if you do not invest in the preconceptional care. So it is really, really important. Next, please. So when you say Planned Parenthood, it is in full. If you say it's Planned Parenthood Federation of America, it is an American organization that, since its founding in 1942, has worked as an advocate for educational and personal liberties in the areas of birth control, family planning, and reproductive health care. Next, please. So talking about, I know this is not something that's, history is not something that's everybody's cup of tea, but I just wanted to give you a little bit background on what exactly is Planned Parenthood. So it was started by Margaret Sanger. She opened the nation's first birth control clinic in 1916. in New York. So at that time, there was nothing that no healthcare provider where women can go access to have any Planned Parenthood services. It was there was a huge maternal mortality because of the ways women would seek abortion, or there were like a lot of unwanted pregnancies. So she identified, she was a nurse. She identified the need to open the first birth control clinic. But again, since it was a new concept, it was not something that women's health was not something that that was a focus at that time. So it was shut down by the police only after 10 days. Sanger's continued efforts led to the foundation of both American Birth Control League in 1921 and the Birth Control Federation of America in 1939, which later on became the Planned Parenthood in 1942. In 1952 is when this came to India, and International Planned Parenthood Federation was created in Bombay, which is Mumbai now. And 67 years later, now this federation consists of 131 member association working in 143 countries with an active presence in further 21 countries, totaling 164 countries in which the federation works. So in 2019, they provided almost 252.3 million sexual and reproductive health services. So basically, their central office is in London, but they work from 5 locations: Africa, the Arab, East and Southeast Asia, and Oceania, Europe network, South Asia, as well as the America and the Caribbean. Next, please. Now, we talked about what encompasses the preconceptional care. So basically, it is, like I said, it's an extension. So it covers some of the aspects of the preconceptional care, but mostly focuses on the birth control, the general health of men and women, HIV testing, morning after pill, pregnancy testing and services, STD testing, treatments and vaccines, as well as women's health care. Next, please. So the Planned Parenthood in India, the FPA, was instrumental in advocating for family planning, which is something to be really proud of as an Indian. It was introduced in the country's first 5-year plan, and India became the first country in the world to have the family planning program. So it is something that that is like I said, as an Indian, it was something when I was reading on it, I thought I need to share this, because it is something that we are still struggling to achieve. But we as a country we were the first country in the world to have this family planning program in place. So we have all the resources, we have all the knowledge. It's the implementation part where we are lacking. So I hope the Planned Parenthood services, as well as in combination with the preconceptional care, is something that we all focus on. We all try to have. When we are involved with the families, when we are involved with the men and women in our society, it is something that we need to bring them into. We need to give them the knowledge, give them the accessibility to the healthcare services, and thus be an instrument in bringing the country together, building up those healthcare programs, and as a healthcare provider, make a difference. Next, please. So, any questions? You can ask in the chat, or you can unmute yourself.
Thank you so much, madam, for your informative session. Madam has beautifully stressed the importance of preconceptional care and planned parenthood within a short period of time. Under preconceptional care, madam has covered what is the need for preconceptional care, why we need to invest in preconceptional care, and importance of preconception care in pregnancy outcome, and what are the areas will be comes under the preconceptional care, what is need for preconception care for men, barriers of preconception care. Under Planned Parenthood, Madam has covered history of Planned Parenthood, which are all the areas to be covered, and in India, situation of Planned Parenthood. Thank you so much, ma'am. Participants are asked to drop the chat box. Our participants are unmute themselves so they can ask the question also. Close. Session. So there is no questions in the chat box. So I can assume that the session was very clear to everyone. Thank you, ma'am.
Thank you so much. So now let us move on to the second session. म्यूट कर देना.
Jeeva ma'am, ma'am, can start?
I think Mrs. Devdani said she will be sharing the screen.
Okay,
So,
ma'am.
will she be?
Yes, ma'am. Debjani will be sharing.
Okay, okay.
So mental health is for women is important, both for their own health and for the well-being of their children and families. So we can say is a need for another. So now I would like to introduce a speaker for this session, Dr. Jeeva Subramaniam. Dr. Jeeva Subramaniam is currently working as lecturer at College of Nursing, National Institute of Mental in organizations like TNI, Indian Association of Neonatal Nurses, and
Next. So I think I'll put up the video so that the load is not so much. So we are going to see what are the aspects of psychological well-being or what are key elements of psychological well-being. Next slide, please. There are six key elements of psychological well-being. They are self-acceptance, personal growth, purpose in life, environmental mastery, autonomy, and positive relationship with others. So as I said, the psychological well-being of an individual is dependent on all these factors. Next slide, please. So what constitutes autonomy? So autonomy is to make the decisions on our own and about how we think, how we behave, and pursue freely our chosen goals that have a genuine value. So this constitutes autonomy. Next, we move on to self-acceptance. So this refers to the acceptance of an individual's strength and weakness, and we are able to understand ourselves as well as others in a non-judgmental way. So this is it to be the self-acceptance. Coming to the competence, competence is always a combination of knowledge, skill, and the right attitude. So that is the ability to solve problems and accomplish worthwhile tasks. Coming to the element, the refers to open to learning and fulfill the potential of an individual. Next week, the move on to healthy relationship, whatever an individual develops, it should be caring, it should be trusting, it should be supportive connections with the other person. The purpose in life, everybody has a sense or purpose in life. So a person with a psychological well-being will have a definite purpose in life, which means they have a sense of direction and value and defined satisfaction in the setting as well as achieving goals. And all these things are encompasses in a wider component called self-care, where we are able to identify and implement any activity that produce positive feelings and boost the confidence and self-esteem, and remind an individual that person's individuals are much more important when compared to the needs of others. Next slide, please. Next slide. Okay, these are few statements which I have brought so that we can understand this key terms in a better way. So how do I express autonomy? What are the statements which can reflect that this particular statement reflects autonomy? That is, when I say the conformity and general consensus, that means I value my decisions. So I value the decisions and the things which I undertake. Next, coming to environmental mastery, I feel that I'm in charge of the situation in which I live. So this is an example, or this is a statement which reflects an individual's control over the environment. Coming to personal growth, a person says that I think how you think about yourself and the world. That means the person has an analysis about the growth, identifies or analysis of the challenges which he or she is going to. Next slide, please. Purpose. As I said, everybody has a purpose in life. Here, if a person says some people wander aimlessly through life, but I am not one of them. That means they have a particular objective, they have a particular direction to which they follow or which they want to achieve the goals or something like that. Coming to self-acceptance, I like the most aspects of my personality. That is accepting a person as it is. It is not like comparing and contrasting with others, being happy with the person who they are. Coming to the last component, the sixth component, that is positive relationship with others. People who describe me as a giving person, willing to share my time with others. So here, they develop a more positive relationship with others by sharing their time and being interrelated to the other person and maybe available at times of need in terms of the help or there. These are the basic elements of the main crux of a topic, is mental and psychological health. So, how the concept learned are going to help us in understanding women's psychology. Women is an exception to that. So, good mental health is always intrinsically important because it offers us a subjective sense of emotional well-being of an individual person or women. And extrinsically also it is important because it represents a significant resource to the broader society in which she lives and works. So the psychological health or the mental makeup of a person, especially of a woman, is intrinsically important as well as it is extrinsically she has to connect with around her. Next slide, please. This is 81. It's health broader category and the environment to interact with one another in a ways that promote subjective well-being, optimal development and use of mental abilities, which includes cognitive, affective and relational. The achievement of individual and collective goals which are consistent with the justice and attainment and preservation of conditions of fundamental safety. So this definition is much more important when we speak of women's psychological well-being. So next slide, please. From the above definition, we can take out, there are certain important components which are very specific to mental health, especially of the women, because from the above definition, we understand that this particular definition stresses the complex of web of interrelationships that determine mental health, and there are so many factors that operate at various levels that will affect the mental health of women. Then it all goes beyond biology of the individual. So gender plays a very important role. So mental health is equal for everybody. It's for male as well as it is for female. And it acknowledges the crucial role of social context. We said that it is in the environment in which the person lives in. So it identifies the society, how this particular person or the psychological well-being of this particular person is going to contribute to the society. It's the importance of justice and equality. Everybody has a right to stay both physically and socially. Why women's mental or psychological well-being is considered very, very important. Why do we focus? Why are we not focusing on men? Because there are some reasons to it. Next slide, please. Because we have certain reasons why it is important, why we are stressing on women's mental health. Because the World Health Organization has submitted a report which says that depressive disorders account close to 41.9% of disability arising from neuropsychiatric disorders, especially among women, whereas it is only 29.3% among men. Leading mental health problems of elderly, especially in the women elderly, are depression, organic brain syndromes, and dementias. Next slide, please. A majority of women, around 80% of people, or displacement, especially this affects more women and children compared to the male population. And when speaking about the prevalence rate of violence, especially when we take the lifetime prevalence, it always ranges from 16% to 50%. That means, which gives us an idea that a woman faces violence at her lifetime on an average of about 16 to 50%. And we also have data which says that at least 1 in 5 women suffer rape or attempted rape in their lifetime. So these are the stats that is helping us to understand why do we focus on the well-being of the women. Next slide, please. We have few more. Next slide. So based on the data which we have now, as well as the health indicators that are available to us, we understand women unspecified psychological distress, which are very, very common, may cope up in a very different by having addictions, substance use disorders, personality disorders. These are very, very common among male. Next slide, please. And we still have some more scientific evidences which have arranged a comprehensive review of general differences in women predominate over men and prevalence in all the general population studies which is done so far. Next slide, please. So they have done a review of 12 studies of this kind carried out in various countries like USA, Portugal, Canada, France, Ireland, Taiwan, Korea, Germany, and Hong Kong. They found only one thing, that is mental and psychological health is affected, and it contributes. When it is affected, it becomes a major problem that needs to be addressed by by individuals and by the healthcare system. It puts a lot of burden on the healthcare delivery system to focus, or it says that turn your attention towards women's mental health because a lot of things going or happening around them. So all these evidences, what we have seen now, have given us an idea that women face a lot of psychological issues and a lot of psychiatric disorders are very, very common among women. So now we are going to see what are the factors which is determining a woman is having a good psychological well-being or it is affected. So we will be seeing in the next coming slides that those factors which are influencing the women's psychological well-being. Before we go into the factors, I would like to recollect the words which were said by William Wordsworth. He describes the women as She is a reason to be firm. She has a temperate will. She is a person of endurance, foresight, strength, and skill. And she is a perfect woman who is nobly planned to warn, to comfort, and command. So this is the women what William Wordsworth has said. But are we having the same what he imagined? How it influences the women's psychological well-being? Women's health is intricately linked to their status in the society. It benefits from equality, but also it suffers from discrimination. Today, the status and well-being of countless millions of women worldwide remain tragically low. As a result, the human being suffers, and the prospect of future generation also is dimmer, because the future generation lies in the hands of a woman who is going to be psychologically healthy. So next slide, please. We'll explore further on the gender. So gender has been described as a critical determinant of mental health and mental illness. In the evidence, when we were describing about, we saw that certain kind of illnesses is very common in females. Certain are very common in males. So gender has been found to be very, very important role or important factor in determining the mental health or mental state of an individual. Speaking about, I would like to throw a little light on the Indian culture, because majority of the people I think we are from here. So I would like to say that how does it influence the mental status of a women? In Indian culture, we have a joint family system. We rely more on patriarchy, where the male member in the family plays a dominant role, and marriage is a must, especially for a woman. And marriage is considered to be a Sanskrit union, and it is a permanent union which cannot be separated. And women is considered to be a subservient status she occupies the role of a daughter-in-law, where she plays the role of subservient. And then the preference for a male child is enormous, and there is a practice of dowry, low education status. And majority, even though we say that there are so many colleges, females have come up, there are still so many parts of our country where women doesn't go to school, or they stop going to school once they attain puberty. Strict code of conduct only for females, and primary roles of women being childbearing age. And there are some certain roles which are very specific to women that we will be seeing in the next slide. Yes, next slide, please. And then we have something called as Indian paradox. So what is this Indian paradox? So the married women with severe mental illness, along with mental illness, in case if she is subjected to domestic violence, she doesn't try to come out of that problematic marriage situation. Instead, makes a frantic efforts for reconstitution of conjugal rights rather than for separation or divorce. So these are all defines the traditional basic Indian culture with which we are being still tied up to it. So these factors, they contribute, they affect the occurrence, manifestation, treatment, and outcome of mental disorders. Especially, they affect the majority of the women in India. Next slide, please. We have to understand the basic difference between men and women to understand this concept further. Women and men are different not only in their obvious physical attributes, but also they are very different in the way they handle the psychology, the emotions, the aspects. So the psychological makeup is basically very different. There are actual differences in the way women and men's brain works and structure, and the way they are connected, wired, and the way they process the information, and the way they react to the events and stimuli that happens around them. The women and men differ in the way they communicate, the way they deal in the relationships, the way they express their feelings, and the way they react to stress. Thus, basically, gender plays a very important role in determining the differences that are based on physical, physiological, and psychological attributes of an individual. Second is the rights of a person, or the right of the women, and what are the things that have been done for health promotion of the women, and what is her status in the society. This plays a very important factor. So we need to look very closely at how differences in the way women are treated. It is very evident from the gender development and gender empowerment rankings, which affect the mental health of the women. We also have evidences on how the society or the factors which are there in the social society and the women's status in the society affect the mental and the emotional well-being. But it is very, very crucial for the development of women's mental health promotion. We need to focus on all this. We need to raise this position of the women in the society. And women's biology and mental health. That is a body or the physical or the physiological structure of the women. The splitting of body from the mind and the identification of women and their health with the body in general and the reproductive functioning in particular has led to neglect of women's mental health and its social structural determinants. Women is always considered as for childbearing and childbearing. So that was the component or that was the idea behind women. It is always thought. People never went beyond that. Using biological differences from men as a chief organizing principle, women's health in the past was only seen in and around obstetrical and gynecology. We never ventured beyond that, but we need to venture beyond because a lot of psychological issues are creeping in. Is it to be done only during the once after marriage or something like that? No. The continuum of women's life and mental and psychological health concern is a continuous process. So it is a continuous process. So it is from the time of birth till she is going to die, she is going to have a lot of changes which she is going to encounter, and along with that, the way she handles that particular changes is going to determine her psychological well-being. So we can see that major changes have occurred in the society during the past half century, and women's life have changed greatly compared to the previous generation. The popularity of higher education and changes in the concepts of marriage have given rise to increasing number of people not marrying, or sometimes they marry later in life, and sometimes this all things can lead to delays in the other events which happens in the life stages of women. Next slide, please. So the other changes which has taken place over a period of time is the longevity or the lifespan of the women has increased, although it is more than the male. Along with declining birth rate, there is a trend for multi-generational household. This also has caused changes in the role in the family. And then we have the onset of puberty and the timing of first sexual intercourse are nowadays happening at very, very lower ages, increasingly happening. So all these changes, along with these changes, the women is going to face a lot of psychological issues. Next slide, please. So we understand that at each life stage throughout the life of a woman is expected to do certain, she is supposed to have certain qualities as well as she is expected to play certain roles. So she is expected to be showing interest in others, especially the family members as a caretaker. She is supposed to pay attention to the care details of the children, play a very important role in child rearing. She is considered to be she should be cooperative and non-violent. She should not express her anger, non-violent attitude, gentleness, and kindness. But these are all the expectation from a woman. But what is happening within the mental makeup of a woman need to be taken care of. And all these multiple roles or all these multiple qualities put pressure on the women, and they affect the degree of satisfaction and the freedom to make major life choices in the women's life. She cannot make decisions in her career, daily living, even in the daily living of her activities of daily living, and even in the care for other family members, she is not the one who is deciding authority. So all these things put a mental pressure on the women to deal with the circumstances as well as with the people in and around her. Next slide, please. So speaking about the continuum of life, I would like to summarize, or I would like to show you a summary of what happens in the women's life and what are the psychological aspects during that time. Let us start from puberty, moving towards sexual maturation period, which is called as the reproductive age, followed by climactic and followed by the post-climactic or the elderly years. Next slide, please. So speaking about puberty, so puberty roughly corresponds to the ages of the students from junior high school through the college. The first half of this period may be specifically called as puberty. The second half follows the adolescence. So during the period of puberty only, one sense of values is developed during this particular period. We all know about the psychologist Erik Erikson theory of psychosocial development. We would have learned about it. He says that the human being establishes his identity, his or her identity during this period through repeated conflicts between the pursuit of ideals and facing various disappointments. So this is the psychology behind this particular age group. Next slide. So the changes which happens in the recent society, as I already said, the rapid development of internet society and the spread of mobile phones, excessive information availability, increased stress, and changes in the role of the family, all these things have exerted various unforeseen influences on the young individuals in this period and how they build their relationship with others. So this is the biggest problem for this particular generation, how they relate to others and how do they develop the relationships. Mental issues during this unstable period, because this is not a period where they are very mentally stable. So unstable period is filled with conflicts. They have a lot of confusions and sometimes they express it by acting out or by somatization. Sometimes it can manifest in terms of OCD or psychosomatic disorders or even eating disorders, especially bulimia. So individuals in puberty are often not fully capable of accurately describing their physical symptoms, or sometimes they don't even verbalize their emotions and affections. So this is the psychological aspect that is happening during the puberty period. Coming to the sexual maturation period or the reproductive period, from the late teens to the pre-menopause in the late 40s is a period of sexual maturation. It is also called as reproductive age. The first half of this period is to build long-term relationship with others, following the establishment of identity, and thus being involved in the society is very, very important at this particular stage. Next slide. Speaking about the psychological makeup here, the individual in this period takes on job. So there is a career orientation here that one can become involved in and is required to make various decisions in her career as well as in the personal life. Women in this period, they have to fulfill a number of roles that relate to well-being of the family, their personal relationships, their education and career goals, and as well as their education of the children, as well as their care towards their family members. So she is being tied between all these roles and she faces a lot of emotional turmoil. Next slide, please. So when she's wandering between all this kind of activities, she's trying to seek perfection. She wants to do everything perfectly. She wants to be a perfect mother. She wants to be a perfect worker. She wants to be a perfect housewife. She wants to be a perfect wife. So she wants perfection in everything she do, but finally what happens? She becomes exhausted. She falls into something called as supervillain syndrome. Everybody tries to achieve this, but actually it is punishing ourselves. We can't be perfect. We need to compromise to make sure that our psychology remains sane. Although it is a very meaningful period because they take a personal decisions, they develop a family, they develop relationships. It is considered to be a meaningful period which is filled with creativity in the life most, and is also the period in which one's identity begins to redefine because we start to have a career. We start to define ourselves in our role in the society. So this is about the second sexual or reproductive age. Next slide. Coming to the climactic period. So what is this period? This period is 5 years before and 5 years after menopause. Is defined as climactic period. So during this period, a woman is said to have reached menopause and there is no menstruation occurred for her for the past 12 consecutive months. So hence, when she reaches this particular period, we call it as climactic period. This period is often overlaps with the timing of the children leaving home. That means the children get either married off when they go away, or they leave their parental home and they go to they go for higher education. They leave their parental homes. So this is here a person develops something called as empty nest syndrome. So they feel that again there is a vacuum which needs to be filled. So a lot of psychological aspects that undergoes here. So the need for care of elderly parents, the changes in relationship with the husband, owing to a loss of couple. Sometimes the husband may be deceased. So they need to cope up a lot of things, their own health and their own psychological aspects. So because of all this, there is a loss of motivation in the life for the couple or for the women or for the elderly persons. They land up in mental depression, they develop physical fatigue. All these things will accumulate and influence the wellness in your women. Sometimes they become depressed, and because they cannot walk, they cannot do the activities which they have been doing all those time, and they also are worried about how much time is left for them to live in this world. So all these things are going to occupy their mind, and this is going to add to the psychological burden. Next slide, please. I'm coming to the last stage, which is called as the elderly years. In this period, a woman's ovarian function is almost end, and now she is elderly, and her physical health is also not cooperating, and they experience the loss of others because they significant others, maybe the loss of the loved ones or the husband or their son and daughter sometimes. So all these things decrease their physical strength as well as it plays an important role in declining their memory also. And other things which are crippling their psychology here is the financial issues. In case if they don't have a proper financial planning well ahead, so the financial issue also may affect their psychology. And coming to the social factors, that is, they need to sometimes live alone or they need to depend on somebody, and they have considerable health problems also. So all these things terribly affects their mental health. Next slide, please. So, feeling anxious about their physical symptoms, the diseases with which they are suffering from, and finally they have reached their old age, and now they start to accept old age, and also they understand that death is inevitable, and they also understand that it is very important for them to conquer their mental issues by keeping themselves healthy or by keeping themselves active. So people look back over their own life and they try to accept the past and try to fill in the gaps with whatever the time that is left to them. Next slide, please. So this is a summary of what we have learned all this time. Starting from the puberty till the person reaches elderly, a woman faces a lot and lot of psychological issues, which we will be seeing in the successive slides. Next slide, please. So, majority, she has a lot of mental health concerns, which we have already seen in the previous slide. So, I'm going to skip this slide. We can move on to the next slide, please. So, now I would like to focus. As I said, there are a lot of psychological aspects and issues which are going to cripple the women, cripple the psychological well-being of the women. So, I'm going to just focus on the more significant ones here. So, we are going to see a glimpse of what are the major mental health issues which affect the psychology of the women. Next slide, please. I will just put it in the picture. These are the common things or common psychological disorders which are affecting women. So depression is found to be 2 times more likely than men in women. Anxiety disorders are also found to be 2 times more in females when compared to men. Post-traumatic stress disorders are found to be 2 times occurring more than men, and women are more likely to attempt suicide, again 2 times more when compared to men, and anorexia and bulimia are more commonly found thrice than men, and we can see that 50% of the women may develop or go into substance abuse or alcohol dependence when compared to men. So here only, this is an area only males are overlying, otherwise in all the other disease conditions, anxiety, depression, post-traumatic disorder, anorexia and bulimia nervosa, and suicide, in all these things, women they have a higher prevalence they have a higher chances of attempting or getting this mental disorders when compared to men. Next slide, please. So we need to be very careful. We need to identify certain warning signs and symptoms so that we are able to identify them at an early stage and take adequate or necessary steps. So we have, I think still more are there. You can click one more. So warning signs like if a woman is going to have persistent feeling of sadness or feeling of hopelessness, so we have to, we have to understand that there is something wrong and we need to pay attention to it. If there is a habit of misuse of alcohol and drugs, and if there is dramatic changes in the eating pattern or sleeping habits, appetite or weight changes, decreased energy or fatigue, excessive fear or worry, if she's going to have hallucination, extremely high or low moods or mood swings, aches, body aches, headache, digestive problems without any underlying cause, being irritable or withdrawing socially or social withdrawal and having suicidal thoughts, all these things are warning signs of mental illness and we need to bring it to medical attention very immediately. Next, please. So here, this is the health-seeking behavior of both male and female. Here also it is the same. Women is supposed to, the health-seeking behavior of the women is lesser for her own problems when compared to the male. And what are the problems for which the males are seeking utilize the health services? When we see men tend to use alcohol as a remedy for relieving from the temporary strain which is caused by external pressure because they feel that there is a loss of autonomy and sometimes they also move into psychotropic drugs. Let us now see about the health-seeking behavior of females. Next slide, please. Next slide. Next. One more click, please. So how does the women try to handle the situation? Women also try to use psychotropic drugs, and whenever they are going to be emotionally taxing, and women are consistently more likely to use outpatient mental health services when compared to men because they utilize the healthcare services for their obstetrical gynecology. When they go for the other things, sometimes they also raise their complaints. So hence, they have found to be better having a health-seeking behavior when compared to males. But what happens is males, they wait till the later stage when it is beyond the level only they report to the healthcare facility. Next. Next slide, please. Apart from that, the second problem which the women face is violence and abuse among women. According to United Nations report, around 2/3 of married women in India were victims of domestic violence, and one incident of violence translates into women losing 7 working days in the country. That means once when she is subjected to violence, she cannot go to work for 7 days in case if she is working. So which is a loss for the economy as well. So we also have a data which says that 70% of married women who are between the reproductive age of 15 to 49 years are the victims of beating, rape, and coerced sex. So all these things are taxing on the psychological well-being of the women. Next. Next slide. And apart from this, women, as I said in the beginning, she has a lot of roles, expected role of childbearing, consequences sometimes of infertility. So that is also a big problem where the mental makeup of the women is being disturbed. And then there is an Indian scenario, we have a failure to produce a male child because male child are considered to be the continuation of the generations. In case if the woman is going to continuously reproduce female child, then she is going to be at the receiving end. Sometimes it also leads to female suicide. So we understand that there are a lot of consequences due to gender-based violence, which are devastating, which will leave lifelong emotional distress. It's not like an episodic. It is going to be there in lifelong. It is going to sometimes lead to mental health issues, especially like post-traumatic stress disorder, as well as it also affects the poor reproductive health of the women. So next slide, please. So common mental health problems experienced by the women who are abused or who are undergoing violence are depression, anxiety, post-traumatic stress, insomnia, alcohol use disorders, as well as a range of somatic and psychological complaints. Battered women are more likely to require psychiatric treatment and they are more likely to attempt suicide when compared to non-battered women. So we can understand it's a mix of so many things a woman is facing, and she's not able to handle it because her psychological well-being or psychology is not so strong enough to handle the situation. So finally, she resorts to suicide, consequences like suicide. This is not the present situation. This is not new for the women. If you take back or if you go back to the history, the objectification of women has always been considered as an object. Those days when the people win in war, the kings, the women have been carried to their places. So violence has been there in one form or the other from the time immemorial. So we need to address this issue. Next slide. This is, all of us are very familiar with this scene where Lord Krishna is trying to help Draupadi when Duryodhana was ripping her clothes apart. This is a part of Mahabharata. So even in the Indian mythology, we have women has been subjected to a lot of emotional trauma and emotional violence. Next. So although we say that we are in the new millennium, we are in the dawn of civilization, women who are living in a patriarchal society of like country like India continues to be oppressed and ill-treated. She is made dependent, weak, sometimes exploited, and she has to face gender discrimination in every sphere of life. So the gender-based violence threatens the well-being of the women, threatens the dignity of women, withholds the right of women, and it is not only to a single sphere, it affects the social, cultural, economic, and regional boundaries across the country. So such is the effect of the psychological issues which a woman is facing. She is facing issue from the time she is in the womb of a mother till she goes to the tomb, that is, till she dies. A lot of psychological trauma is being faced by the women. Next slide, please. And I have summarized it. These are the most common ones like female feticide, female infanticide, child abuse, sexual violence, forced marriage, domestic violence, forced childbirth, human trafficking, acid attacks, and elderly abuse. If you want, we can put the list as endless. These are the blues which a woman faces from the time she is born till she dies. So it is there. The violence has become a part of her life cycle. But this is not the end. This is not the way she is being designed to live. There are some other aspects which we have to help the women to come out of this particular vicious cycle of violence. So what can we do? Next slide, please. So we need to advise or create awareness among women about mental health and how to take care of themselves. When we saw in the previous slides, when we learned about the key elements of psychological well-being, we saw one big circle of self-care. So self-care is the best care what a woman can do to herself, because we know her as a carer, we know her as a mother, we know her as a person who is taking care of others. But women need to understand that she needs to take care of herself first in order to take care of others. So we are going to see what are certain interventions that can be done at the individual level and at the community level. So as I said, women needs to take care of her immediate needs, and she needs to be protected from the risk of infection or any other kind of threats in any other forms, whether it is physical, psychological. And she needs comfort, and she needs console, and she needs to support from the practical task, from the significant others. We need to create awareness by providing information, and we need to help her to cope when some situations she is not able to handle on herself. Then she needs to connect with social support systems which are available in the society to handle with her issues. And most of all, she needs to be educated about what is normal and what is abnormal. So she needs to understand herself better in order to take care of others. So next slide, please. So she needs to have a positive thinking where she needs to recall the positive life events, perform acts of kindness, express gratitude, practice mindfulness techniques or relaxation techniques that is helping her to keep her mental makeup in a proper way. Next slide, please. So these are the things that can be done at the individual level. As an individual, we can do that. But what should we do as a country as a whole? Because we are the women of the society is not a single person. The women of the country is not a single individual. We have quite a large number of people undergoing and facing whatever we have discussed in the previous slides. So as a country as a whole, how are we going to address about this issue? So it is therefore very, very important that a women's mental health cannot be considered separately. It is not an entity that needs to be isolated and looked into. It is a combination of physical, social, political, and economic issue, not only of the women, of the whole nation. So we need to understand that the physical and the mental health of a woman across the lifespan should be emphasized, and we should not see only in a narrow perspective of maternal and child health. We need to focus their psychological well-being, especially taking care, incorporating those strategies in the healthcare policies of the nation. So next slide, please. So what can we do? We have to provide education, we have to train them, and we have to provide them strategies or interventions that may target the social and the physical environment with which where the women are living, thereby addressing the women's mental health issues. We have some primary care providers, the healthcare workers who are there at the local level or at the grassroots level. They need to be taught about what are the common problems, especially the mental health problems which affect the women. And they also should be routinely inquiring about common mental health problems. They provide appropriate intervention, support, and they also need to provide education to the community on issues which are related to mental health of women. Next slide, please. And we have a healthcare system. The country has to develop and adopt strategies that will improve the social status of women. As long as the social status of women is going to improve, there is not going to be women empowerment. So we need to remove the gender disparity. We need to provide economic and political power. We need to increase awareness of their rights and so on. We need to do whatever that will help a women to lead a normal life. We need to make concerted efforts at social level, political level, economic level, and legal level also to bring a change in the lives of the women and contribute to the improvement of mental health aspects of this women. Next slide, please. So, what we can do is, in order to promote the psychological well-being, the healthcare institutions or the organizations which provide healthcare services to the people, they need to focus on, they need to address the psychological issues which are very common among women, and by supporting the clients, by offering the services, whatever is necessary to address those issues. And healthcare providers like we, like doctors, nurses, psychiatric social workers, community health workers, we are in a very unique position to address the health and the psychological needs of women who have expressed mental and psychological issues. So we play a very important role. So our role should not be undermined. So we need to take the mantle in our hand to handle to promote the mental well-being of or the psychological well-being of the women. Next slide, please. So if I, as a single individual, I as a healthcare person, what should be in the place of work? How can I help a woman? First thing is, I need to be trained to identify mental health illness or mental health disorders. So the healthcare provider should be trained to identify the blues, what the woman is undergoing. Is there something beyond? Sometimes a woman comes with some kind of injury, or sometimes she reports to your hospital with some kind of bluish thing. So what we have to do is we should not just focus on only treating it. We should know what is the cause for it, and we should try to address that particular issue. And for that, we need to have certain kind of standard operating procedures in place, and we need to make sure that the consultation takes place in the private setting. It is handling somebody's psychology is not a public domain. They are going to vent out their emotional turmoil outside. So we need to arrange for consultation as well as for counseling sessions that need to be happening only in a private setting. In case if you are not properly equipped to handle the situation, there should be a referral system where you can appropriately refer that particular woman to the place where she will be getting that particular service. And healthcare setting should be equipped to provide a comprehensive response where physically and mental aspects also can be taken care. And sometimes when it is very consequences are like suicide and all, we need to go beyond. We need to gather forensic evidence to find out what is the reason for which she has committed suicide. So all these things add value to the profession with which we are in. So healthcare professionals or personals have a very important role to play in enhancing the psychological well-being of the women especially. Next slide. So this is a simple acronym which we have found that is, it says lives. So what are we supposed to do when a person with an emotional disturbed person comes to us? So we as a healthcare personnel should listen closely with empathy and with a non-judgmental attitude. Inquire about their needs and concerns, validate their experience, show you that believe whatever they say, and you also understand their concerns, and you also have to enhance their safety. Sometimes domestic violence, it is very difficult to handle the safety issues. So enhance their safety and support them to connect with additional services. In case if you feel that they need, somebody can do a better job than you, or somebody can offer additional services, what is required for her. So you need to help her to get those kind of access to those kind of services. So we do not do any harm. We need to respect the wishes of them and try to help them. So this is the role of a healthcare personnel. Next slide, please. And finally, coming to the legal remedies, we have everything in place, but still we have problems. Only thing is enforcement of this legal remedies is the only solution. We have it in the paper, but we are not putting it in practice. So the Constitution of India, Article 14, it speaks about equality. It says that men and women are equal. Article 21 says that a person or an individual, whether you are male, female, transgender, you have the right to live with human dignity. So this everybody has to remember this, and we need to understand that our Constitution itself is providing us the right of equality. It doesn't discriminate us based on gender. So we need to make sure that we are equal and we have to work for it. Then there is National Commission of Women, which recommends remedial legislative measures. It facilitates it redresses the grievances of women, and it also advises government on all policy matters which are affecting women. Then we have Supreme Court guidelines on sexual harassment at workplace. This is also a very common problem nowadays. So we have the guidelines that need to be adhered to. Then we have legislation like Dowry Prohibition Act, Protection of Women from Domestic Violence Act. All these things are to safeguard the women's psychological well-being only, provided they are utilized. That's the thing. And for health policy, for the whole of the nation, what are we supposed to do? We need to make sure that gender-based barriers should be removed. If we remove that only, we will be able to have an access to mental health care, and that will be for the whole nation. And we need to focus on public health approach rather than focusing on only gender-specific approach. And then we should not have gender discrimination, we should not have gender-based violence, and we should not follow gender role stereotyping. All these things should be addressed by either laws or by policies or by programs or bringing out certain kind of interventions. Next slide. And a very important role is training the healthcare workers to identify and treat mental disorders at the grassroots level itself, at the beginning stage itself. That is very, very important. And the provision of community-based care, because you can't keep the person in the hospital for so long. So what you have to do is, we have to make sure that the services are extending to their home. So community-based care for chronic mental disorders should be organized so that the specific needs of the women as well as men are met in the places where they are residing. Next slide, please. So at the end, I would like to conclude by saying that there are health policies, but we need to make sure that the health policies are implemented, thereby they become healthy policies for both, so that they can be fostered and they can be provided ways to encourage the mainstreaming of gender perspective into the health sector. We need to focus more. We need to look beyond what are we seeing externally. And a lot of specific initiatives and strategies and interventions we have discussed. All these things are there in the domain of mental health. But what is the only thing is, we need to implement them by the help of the local governments, international agencies, and we need to do a lot of research in the community to bring about the issues that are underlying, so that we can address them in a more positive and productive way. So with this, I conclude the session. And I think next slide is there. I would like to conclude with the verses of a poet called Bharadiyar. He speaks about women empowerment. You can see that the time he was born 1882 and he was there alive till 1921. So at present moment, if we speak about women empowerment, I will be very happy because we say that we are always a forward-looking generation. But you can see the era or the time when this particular person has lived. He said that world will only prosper in knowledge as well as intellect if both men and women are deemed equal in all aspects. It is not only physical, mental, social, in every aspect. In the society, you should treat them very, very equal. And women empowerment is also one of the initiatives or the strategies to promote the psychological well-being. And the other verses which is there in the Tamil language, it says or it summarizes how a woman should be. He says that, I just translate for you people, it says that a woman should be walking straight with her eyes focusing toward the forward direction. Her eyes should not be towards the ground and she should not be afraid of anything. She should not be controlled by any rules, regulations, and she need to have a great intellect. Because of that, when she has the great intellect, that will help her to have this kind of vision. So that is the thing what and when somebody is trying to say that you are subservient to me, you are subordinate to me, you are not in in equal with me, he says that you spit on their faces. Literally, he says that. So he says that I think women should reach to that particular stage where this particular poet dreamt of what a woman should reach to that particular height. So with this verses, I hope that the session was useful in understanding the makeup, psychological makeup of women, and in understanding the problems which they face, and what are the role of individually as well as collectively as a nation, as a society, we need to do. So with this, the next slide, please. Next slide. These are certain references which I used for preparing this material. Next slide, please. And I would like to thank every one of you for your patient listening for all this time, and also for tolerating the internet issues. So thank you, and thank you once again.
Thank you, ma'am.
Madam, thank you.
Are requested to ask a query. Either they can write it in the chat box or they can unmute themselves and ask. So there is no query from the participants. I hope it was so clear. So today, Madam has detailedly explained about the importance of psychological well-being of women in each stage with the latest evidences. And Madam has covered how the women are vulnerable to mental illness and why psychological well-being is important, especially for women. What are the determinants of psychological well-being? How the life stages of women affecting their psychological health? And what is the status of women in India, like developing countries? How they are subjected to domestic violence and how it is affecting their mental health? And how to take care of women psychologically and what are the strategies to follow? So, as a health personnel, we shall make aware about the importance of psychological well-being for women, among women as well as in the family. Thank you so much, Madam, for your detailed and excellent session.
Thank you, Madam. Thanks a lot.
Thank you, ma'am.
Thank you. Thank you all.
Thank you, ma'am. So today we are completing the scientific session. So this is a message to the participants. Tomorrow the session will be at 10 a.m. You can join from 9:30 onwards. Thank you everyone for your kind cooperation. Have a good day.
Thank you.
Thank you, ma'am.
I have to go and prepare an essay.